Hello, everyone. My name is Jen Braun, and I direct the AHA Team Training Program. Welcome to our January webinar, Happy New Year, on utilizing team-based care and TeamSTEPPS to strengthen and support today's interprofessional workforce. And so the format of this webinar is a bit unique compared to what we normally do. So we're going to have a facilitated conversation with a nurse and physician leaders rather, about how TeamSTEPPS and team-based care can support the workforce. And then we'll open it up to questions from the audience. So it's really meant to be an interactive and informal webinar today. I'll introduce our speakers here in a moment, and I'm going to go over some rules of engagement and announcements first. So you can access audio by listening in through your computer speakers or through your phone. If you're having issues, you should be able to access that toolbar at the bottom of your screen to switch to either phone audio or computer audio. And so please note that you're in a listen-only mode. And so if you have questions for the speakers throughout the webinar today, please chat them in, as I'll do a facilitated Q&A in the end. If you have any technical or logistical questions, we'll answer it in real time. But if it's for our speakers, we'll save that for the end. So moving on to continuing education credit, we're happy to offer CEs for our webinars. In order to claim your CE credit, you must create a Duke OneLink account. Duke helps us provide those CEs. So this is a one-time only setup. So if you've done it before, you don't need to do it again. But my colleague Kara will be chatting in those instructions. And you can also refer to the email that was sent to you this morning that had an attachment with additional instructions. And so following the webinar today, you're going to text KEBTAY to the number you see there. And we'll share this throughout the presentation and then again at the end. So registration is now open for our two-day TeamSTEPPS Master Training courses for the first half of the year. Much of today's webinar is going to focus on how interprofessional teams can benefit from TeamSTEPPS. And we'll be sharing more about what makes our course unique beyond covering the TeamSTEPPS 3.0 tools to help support the workforce. So if you're interested in registering for one of our courses, please note that we highly, highly encourage teams to attend and have a team discount available. So you can visit our website to learn more, and Kara's chatted in that link. In addition to our in-person courses, we have a virtual master training course that begins in mid-April, and registration will open in the next in the upcoming weeks. So keep an eye out for that. And in terms of our webinars, we have two more TeamSTEPPS focused webinars to kick off our year that really complement one another. And so our February webinar will have 3 implementation stories from across the country. And the stories are diverse in terms of where they're at in their implementation and their implementation setting. So we have one case example where they're about 6 months into their implementation in labor and delivery, and then another one who's years into their journey and is really focused on sustainability. So there'll be plenty of time for Q&A during that webinar. So a really great opportunity to hear successes and challenges from other organizations and get your questions answered. And then finally, in March, our webinar will focus on how to action and plan your TeamSTEPPS implementation. So that will be a bit more hands-on. So registration for both are now open. And then finally, if you're looking for a more customized training solution, we offer on-site trainings where we come to you to deliver anything from a 2-day master training course to a comprehensive training program that spans multiple on-site trainings and virtual coaching to really support your TeamSTEPPS implementation efforts and help with sustainability. And so you can visit our website to learn more. There's an option to complete a questionnaire where one of our team members, Rhonda, will follow up with you one-on-one to discuss it in more detail. So with that, I would like to just quickly introduce our panelists today. You're going to hear from them in a second, but many of you are familiar with and have come to love Rhonda Fisher. She is one of our AHA nursing leaders and our team training clinical program lead. I'm also pleased that we have Dr. Chris DiRienzo, who is AHA's Chief Physician Executive. So I expect us to have a fabulous conversation today. And so before I let them introduce themselves in a bit more detail, I just wanted to share our objectives for this conversation. So during our facilitated conversation and Q&A with Ron and Chris, you'll understand the importance of how an interprofessional team can utilize TeamSTEPPS to improve staff satisfaction, retention, and ultimately patient safety. TeamSTEPPS has always been at its core a patient safety program, but now more than ever, it's critical for staff to provide mutual support to one another, maintain a shared mental model, and utilize common language. So next we'll address how AHA Team Training's TeamSTEPPS curriculum has been enhanced to address those global changes in healthcare and the workforce challenges. And then we'll share the various roles an interprofessional team has when implementing TeamSTEPPS. So that's the lay of the land for today. And so I'm going to kick things off. I'm going to stop sharing my screen just so we can see everyone's faces here. And so I would love to let each of you introduce yourselves and share a bit more about your clinical experience.
Ladies first, Chris. Well, hello, everybody. So excited you're joining us today. My name is Rhonda Fisher, and as Jen said, I am the clinical program lead for team training at the AHA. But my clinical background is what I always describe as a hardcore bedside ER nurse. I've been a nurse for 31 years now. I can't hardly believe it. I started by dabbling a little bit in L&D and then community and migrant health. And then I found my greatest love in ER and trauma. So that's the basics of my background. My father, on a personal note, my father died of medical error at the age of 58. And that's when my passion for patient safety began. So I became a TeamSTEPPS Master Trainer in 2009, and I've been involved in the patient safety movement nationally since 2010.
Thank you, Rhonda. We are incredibly lucky to have you on our team here at the American Hospital Association. I'm Dr. Chris D'Orienzo. I'm a neonatologist by clinical background. My first job in healthcare was as an EMT up in Massachusetts 25 years ago. But I've spent most of the last 10 years as a chief physician in health systems in North Carolina. I joined the AHA a year ago to be our chief physician. And part of that work is to get to work with the incredible team that you see here today. I think that both Rhonda and I come from a clinical background, and certainly important to note that we've seen great successes in the clinical environment using the TeamSTEPPS framework. But I've already seen a question in the chat and just want to reassure you from the outset that I've also seen the models that we teach in TeamSTEPPS used with great success outside of clinical care delivery. And so that can be in clinical operations or in non-clinical operations. And to be totally frank, we've used models that exist within TeamSTEPPS here at the association because they're just such efficient tools for supporting team-based communication. So I will leave the teaser there and hand it back to you, Jen, to bring us into the conversation.
Yeah, I echo that. We practice what we preach here at AHA Team Training and use the TeamSTEPPS tools all the time in that non-patient care setting. So thanks for bringing that up. And we feel the same about you, Chris, joining our team now that you're a little over a year in?
You got it.
Perfect. So I'm going to kick things off with a bit of a level setting question. So we all have a shared mental model. So can you provide just a brief definition of team-based care in the healthcare setting? And have you seen that definition change, shape, or evolve over the course of the last few years? And what is that implication for healthcare teams in the year of 2024?
Yeah, I think as I reflect on what I've seen in 25 years in healthcare, there are really two axes on which that team-based care model has changed. I remember my first job working in a hospital was as an ER tech, and the team at that time, frankly, was smaller and extraordinarily hierarchical. And you could see orders flow this way. There was unidirectional communication. There weren't readbacks. There weren't check-ins. And the team still worked and they functioned great. But I think what we've learned now of over 2 decades in research on how we improve care delivery and learn from other high-risk scenarios that exist in aviation, that exist in nuclear power, that have existed elsewhere, that hierarchical nature needs to flatten, and frankly, it has. So, when I went to medical school and was taught as a physician, you're captain of the ship and the ship looks like this. Now the ship looks more like this. And yes, while at the end of the day, the provider in the room still has to sign the order or take accountability for decision making. It's much more of, as I've observed through my career, it's much more of a collaborative process. The other important change, and I'd be remiss if we didn't bring this up, is that the team members themselves have changed. 25 years ago, we didn't have the presence of incredible team members like PAs and NPs that we have today. The role of nurses and nurse techs and ER techs has significantly changed. And of course, our GME programs, what we ask residents and fellows to do today looks a lot different than we did in the late 90s. So a lot of evolution, but at its core, team-based care is about how we leverage every team member at the top of their license and at the top of their contribution to be able to get our best possible outcome, either for our patients, if we're talking about clinical care, or for whatever challenges we're trying to solve.
Yeah, gosh, Chris, so well said. I would say, just to summarize some of those sentiments, when I think about team-based care, really what I think about is patient-centered care through a team-focused lens. So it's that idea that multiple health professionals, I love, Chris, how you mentioned about just that flattening that hierarchy and making a space where every voice gets to come to the table, right? Every discipline, whether it's nursing or allied health or human resources, even for that matter, right? And each member contributes their unique perspective and their unique expertise in order to develop a really comprehensive, holistic plan of care for the patient. So I would say at its essence, I don't think the definition of team-based care has changed much, but rather the need for it is so much more amplified today. As Chris said, team-based care means we're all operating top of license, right? Everybody contributing a very full picture of what their particular discipline can offer to the patient and to the team. And when that happens, the patient's getting the right resources at the right time. That means more efficiency, less resource pull to get to the goal. And that's just going to help us in healthcare walk away feeling like we've been able to give our best for the patient through this process of team.
Yeah, exactly. What I'm hearing a lot of, listening between the lines is the need for psychological safety in teams, which we'll definitely talk about more throughout this conversation. But, I want to talk about the intersection between TeamSTEPPS and team-based care. But to begin, let's just level set for our audience once more. So a majority of the folks on the line here are at least aware of TeamSTEPPS. There's a range of people who have never implemented before to those who have quite a wealth of experience. But Rhonda, can you just briefly describe TeamSTEPPS?
Yeah, I'd be happy to. I live for TeamSTEPPS around here. So TeamSTEPPS stands for Team Strategies and Tools to Enhance Performance and Patient Safety. And at its heart, it's really a communication and teamwork program. As Chris mentioned earlier, it is built on more than 30 years of research on teams and team performance and very high risk, high stakes environments like nuclear power, the aviation industry, the military. Those are industries that have been chasing zero harm for decades, and they're winning. So healthcare began to learn from these industries to kind of cross-pollinate, if you will, the tools and concepts into our own high-risk environment. The tools themselves, y'all, they are not rocket science. I will be the first to say that. But here's what I want to say. When those tools are rooted into healthcare culture, they are extremely powerful for creating high reliability in the areas of leadership, communication, mutual support, situation monitoring. And when we get really effective, efficient about operating in intention across those 4 domains, I'm telling you, that is where the magic happens. That's when we get safer patient care. That's where we get healthier, happier teams. And for myself, I want both in the year 2024.
Well said. You kind of touched on this, Rhonda, but how do you to either of you, how do you see TeamSTEPPS contributing to or enhancing team-based care? I know you kind of touched on that in your previous questions, but really directly how TeamSTEPPS can enhance team-based care.
Go ahead, Chris.
Yeah, happy to take a swing at that one. And I'm seeing in the chat a few folks have mentioned other clinical team members who are part of that team. My specialty is neonatology. And so when I think about ideally, if I could round with our care coordinator and social work and the pharmacist and our nutritionist, that kind of model where we bring everything that we can to bear for the improvement of the patient's outcome, that's sort of in the DNA of folks who practice in my specialty. Where it can be challenged and where I think TeamSTEPPS provides a pathway to improving the function of that team is that those individual team members come from vastly different backgrounds. And the way that you're trained in pharmacy school or medical school or nursing school or in your social work program or nutrition, you come with a different vocabulary, you come with a different structure to your dialogue. And at its core, right, at its core, what TeamSTEPPS provides us is a structured mechanism to communicate with each other. I think about early in my training as a NICU doctor, it would take me like 5 minutes to convey what now I can communicate to another member of the NICU team in like 3 sentences, because I know what to expect when I hear the sentence, former 23-weeker who's now 2 weeks old with history of ABC. I've got a mental model in my head immediately for what that looks like. And what TeamSTEPPS does is help translate that mental model in a way that is easy to cross team disciplines, and it's easy to cross team implementations. So our non-clinical member in the chat, the same kind of process can be used when talking about a capital improvement project, or when talking about planning a webinar for hundreds of people who have signed up to learn about TeamSTEPPS. That's what it does. It does a lot more than that. But the tools and the shared expectations that come when we both learn about how we're going to communicate under these circumstances together leads to greater efficiency and, frankly, an easier time to get to where we all want to get to.
Yeah, and I would just add to that. Am I on mute? No, I'm good. I would just add to that I saw in the chat that can you address the challenges and solutions? Basically, what you're talking about, that revolving door of staff, right? That's physicians, that's nurses, that's pretty much anywhere in healthcare these days. And this is the beauty of what TeamSTEPPS brings to team-based care. Because as Chris stated, right, if I'm in the ER and I'm telling you what, it's all burning down, and I'm like, just send me someone with a pulse, I will take it, right? And in those moments, TeamSTEPPS gives me the ability to interact with a teammate I may never have even seen before. And because we're speaking the same language, because we're used to some of these processes for high reliability that TeamSTEPPS breeds, we can get out of the chute quicker together, be on the same page, have a shared mental model. So I don't see team-based care happening at all without a program like TeamSTEPPS that is addressing communication and teamwork on a dime.
Yeah, the revolving door of team members is really similar to the aviation industry, like Chris, you alluded to, and where TeamSTEPPS stems from, another high-risk industry. And so similarly to healthcare, that rotating member of teams happens on an airplane. Oftentimes the captain and the flight attendants are meeting for the first time, or the first officer and the captain are meeting for the first time. And in our TeamSTEPPS courses, we showcase the landing on the Hudson. That's about 15 years old at this point. So Sully Sullenberger and Jeff Skiles, who were the captain and first officer, met that day. They had never met before, yet they were able to successfully keep their entire crew, all the passengers, safe on that emergency landing because they had a shared language, because they were able to communicate effectively. They were able to raise concerns. They had psychological safety. So there's so many similarities to the aviation industry as well. So just that kind of struck a chord for me. Moving on to the next question I wanted to ask. Throughout your careers, I think between the two of you, if I heard correctly, there's about 55 years of clinical experience. I'm not sure how that lands for you, but what are the most common teamwork and communication challenges you've experienced when working with interprofessional teams?
Yeah, great. So I would say as a nurse, probably the top challenge that I've experienced both personally and in my work with teams across the nation is hierarchical culture. And even though, like Chris said earlier, we've really made some strides there. So happy about that. But hierarchical culture really, it's really that idea that he or she who holds the most power wins. And why that doesn't work in healthcare is it sends the message that the contributions of team members are on a gradient, right? Like they're not equally valued for their unique perspective and the role that they play. And I want to be clear that I'm not just talking about physicians to nurses. I have seen hierarchical culture be alive and well, nurse to nurse or nurse to allied health professionals. I've even seen it I'll just call it misguided designated leaders with their teams. And what happens is in a hierarchical culture, we fail to bring every voice to the table. We fail to empower and value every voice. And that's always a setup for dysfunction and dissatisfaction among a team. So that's probably my top one. And I would just add one more that I've seen be a challenge for teams in trying to get TeamSTEPPS up off the ground. And that's a lack of accountability for non-adopters. Now, please understand that I am not talking about late adopters. I teach a whole other workshop on temperament. Late adopters, that's really temperament and needing a little bit more time to work through the process. I'm talking about the heels dug in non-adopters. And this is those folks that you've worked the process of, I call it the 3 C's. Clear as kind, create a path, and close the loop. Clear as kind, you've gone to them, you've provided clarity around the ask. You've created a personalized plan forward for them. What is it that you need uniquely to be successful with this TeamSTEPPS implementation? And then closing that loop on the bar of expectation for when their train is going to run out of track if they fail to engage. When you fail to bring accountability to that process, the whole team's going to lose faith and decide that change is optional. And we cannot afford to have that among our healthcare teams of today.
Well said, Rhonda. The only thing that I would add is, as in attending, my biggest fear has always been someone else knows, and frankly, not just as an attending physician, but also as a senior leader in any organization. My biggest fear has always been that I'm about to make some very obvious mistake that is not obvious to me, but is obvious to someone next to me, and they're not going to tell me it happens. And that stands for a code environment, that stands for clinical decision making, it stands for operational decision making. And where TeamSTEPPS helps with that is by offering this shared level of engagement where, and I have to reinforce that as a leader, where I want you to speak up, and then here's the model in which you speak up if we're standing around a bedside, and you don't have to say, "Dear Enzo, you're about to be really stupid," right? That we create language that is signaling for each other, so that we offer the opportunity for everyone to contribute to that best outcome. And there are lots of ways you can get there. But what TeamSTEPPS does is creates a shared model for doing that across all disciplines. And that I think is fairly unique.
Yeah, I agree. And we'll definitely talk about the importance of having multidisciplinary and interprofessional teams in the same room when it comes to those TeamSTEPPS trainings. But yeah, definitely agree there. So Chris, specifically to you, given what you've seen in your own practice, in addition to visiting hospitals across the country during your first year in the AHA, how has TeamSTEPPS been used in various settings?
I've learned one big thing, Jen, in spending the first year that I have with the association. I guess I've learned two things. First, that we are member focused first and foremost, and know that we exist to deliver value to folks like you. And so we try to pay very close attention to what our members are telling us. And we've heard from them over the course of not just this year, but multiple years, a lot of the frustrations that we've seen pop up in the chat, frustrations with evolution in our workforce, frustrations in challenging circumstances that arise. But one thing that I see that's consistent, whether I'm at a critical access hospital in Northeast Kansas that has an average daily census of 2, and is serving a community of several thousand folks with an ER and an OR and an ambulatory coverage, or if I'm in one of the largest academic centers in the country with 1,200 beds and every spectrum of student learner, no matter the geography, no matter the size, challenges frequently come back to communication. And even in those smaller settings where historically teams have been together for a really long time, the past 3 years have stressed everyone. And so we've seen a lot of change in our workforce. And without the kinds of history that we could rely on in the past, if I'm putting lines in on a baby and I've worked with a nurse for 7 years, and he knows how I hold a scalpel and how I hold this, you don't recreate that in a day as you have the kind of turnover that we've seen. So I've seen TeamSTEPPS work as a model to be able to solve for that challenge. How do we, Rhonda, I love the word that you used, how do we get out the chute faster together? And it is equally applicable in a critical access environment as it is in an extraordinarily large academic center.
Yeah. And Rhonda, I know in your previous hospital, you utilized TeamSTEPPS there. So can you provide examples of how TeamSTEPPS was used successfully to overcome those particular teamwork and communication challenges?
Oh my gosh, absolutely. So I'll just list a few quickly here because Lord knows I got many. So first, huddles. Oh my gosh, in an emergency department, again, that's the bulk of my career. The ER status quo can change on a dime. So that huddle, that ability to pull the team together, reassess and redeploy, it's a beautiful thing. Call out, check back in high risk, high stakes events like codes, where when communication and teamwork breaks down, the patient's going to pay the highest price. And so is the team, to be honest. And then other places where I've seen beautiful TeamSTEPPS tools in action, debriefs that create a learning environment, right? As opposed to one of shame and blame. And then peer-to-peer accountability. When we get good about resolving our issues together, face-to-face, as opposed to expecting a hammer down from top to bottom, it's so much more effective. I've seen teams that have been able to get up and really operational in tools like Desk, for example, and have these critical conversations that have completely changed the tenor on the unit. So it's very practical. It's yes, it works.
Yes. I like that. I want to jump ahead since we have a few minutes left with us, and then I want to make sure we get a lot of the questions answered from our audience. So, there are many different ways to approach TeamSTEPPS training and implementation. It's not a one size fits all program, which is great on one end, but sometimes can be challenging on another end when you're looking for direction, you're looking for guidance. So can you paint us a picture of how your previous hospital employers trained in TeamSTEPPS? So like, who was involved? What was their roles? What was the training format?
I'll take a quick stab because my first engagement with TeamSTEPPS was almost 20 years ago now. And I was part of one of the early design sessions as a medical student, where we were exchanging roles with others. And in that model, the concept was if we begin training team members from different clinical disciplines in these shared communication models from the earliest stages, then perhaps we build a different workforce. And so now what I've seen in the evolution of that over 20 years runs the gamut. And so Rhonda, I'll pitch it to you because I know we have seen unit level implementation, we've seen hospital level implementation, we've seen system level implementation. Everyone has a different burning platform. And I think we have some recommendations for best practices in approaching that, but we also are able to to make some tweaks to the curriculum and to the model so that it fits with how best to solve your challenge at the level you're trying to solve it.
Oh yeah, absolutely. So I think, of course, as Chris said, we have our own ideas about what we would recommend as ideal, but the beauty of TeamSTEPPS is it's not an out of the box, right? Like we can customize that thing. We can help you customize it, help you put it into the time frame that you have available, for example, to train. So our ideal is that, you know, every organization, hospital system has a core group of master trainers that then is going to spread out and get everybody across the organization or across a particular department trained up in the essentials of TeamSTEPPS. So I've seen that look really differently. I've seen it be in extended staff meetings. I've seen it be just once a month where every new employee gets, you know, routed through a 4-hour essentials course or a 2-hour essentials course. I've seen it happen through just tool of the month, if that is what needs to happen. So I think that the things that I would emphasize is no matter how you choose to do it, there has to be a commitment to train, right? So you've got to decide, this is what we've got to work with, this is how we're going to do it, and we're committed to it. And then tie it into the things that motivate and incentivize. Like in my system, for the providers, for example, it was tied to credentialing. For nurses, if a certain amount of time ran out and they had not yet done their TeamSTEPPS training, they didn't get to come to work. So, you know, being able to employ again those structures of accountability and do that, our favorite, we would always recommend an interdisciplinary training. But for example, if you can only get your docs alone and together in one period of time over here, or I've done it where I've trained just the residents, for example, because that's the margin they had to give. So lots of different ways.
And Rhonda, can you share about a bit more? We'll talk about this at the end in a bit more specific detail, but in your own experience, can you share more about the who was involved in regards to the oversight of TeamSTEPPS and who was involved as a master trainer? Because what I'm getting at is essentially for the longest time, it was seen as a nursing initiative. And I've seen that shift, but wanted to get your, you know, boots on the ground view of that.
Yeah, it has shifted. Can we all just say amen? Right? No, it takes that engagement. It takes starting honestly at the C-suite level. It's lovely if you can get someone who's engaged from that level in your organizational change team. But with the team that's going to drive that change across that organization, you absolutely will need to have some physician champions. You need to have the voices of influence for the people you're going to impact. So that means getting physician champions on board. That means getting frontline people involved as much as you can. You need their voice. They're the ones out there with their elbows in it every single day. So they can inform and tell you what works the best. Employ your patient safety folks, because as you heard us do in our webinar last month, data, 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 right? We want to show this works. It does. So set yourselves up for success by putting people on your change team that know how to go get it. And then your educators, for example. So you can see it's a very well-rounded, from C-suite to physician champions, to nursing leaders, to all the folks on your front line, and all the people that can come around from the back end and show you that it's worth your time to do it.
Rhonda, I love that point, and I want to double click on it, that as we bring folks together for that kind of training, it is crucial, absolutely crucial to success, that we're clear on this is the challenge we're trying to solve for. And so we've certainly seen some folks come to us after they've been through a very challenging event. And there's a clear and crystallizing, you know, reason that we learned we need to have this kind of training together so that we all up our team performance. But sometimes it's a different challenge that folks are facing. In my experience, especially as you're trying to communicate with your medical staff, being very, very clear on the front end that here's what we're seeing and what you're telling us is a challenge. Here is how others have solved for it. And we are implementing this program with a level of shared accountability for each other because this is intended to make it better. And then here's how.
Right. And just to go back on, the fact that this is not a nursing initiative, I failed to mention during the beginning announcements when I shared all of our upcoming courses, our June course that will take place in Chicago will be led by the three of us here. So you have, a nurse, a physician, non-clinical hello, to really have that interprofessional team. So just wanted to give a little plug for that. So one last question for you two, and then we'll open it up to the audience. So looking back in your TeamSTEPPS experience, what were the two biggest strengths of the TeamSTEPPS program or the TeamSTEPPS tools you were exposed to? And what was one opportunity for improvement that you wish you could have gone back to address or revise?
You want to start that one out, Chris?
Sure. I think so. First off, in terms of successes, the model, the core of this model is at this point timeless. When we talk about checkbacks and rebacks and huddles and S-bars, that this should be required reading in table stakes just for operating in healthcare. But then the magic, and what I've been reflecting on so many years now, the magic of seeing that in action and how much more efficient everyone's time gets is really powerful. If you ask, and I've now asked literally hundreds of healthcare professionals this question, what brings them joy to their professional life? It's spending more time with my patients and more time with my people. And we waste a lot of time communicating in ways that are not very efficient because we don't have this kind of team-based model of communication there. And so if I had to say the biggest thing is once you've gone through the training and then gotten over that cliff, the level of energy required to engage as a team goes down so dramatically that you get to invest that energy elsewhere. And so that's really powerful. I will say that having now joined the AHA, I remember some of the early implementation sessions, especially in the master trainer course, which I got to teach for a while. And I will tell you that the challenges I had with those, we are continually revising. And I think that's one aspect of the master trainer courses that we get to put on with partners across the country is we can continually evolve the curriculum such that it is not only relevant to a 2024 model of care, which is continually changing, but also it continues to learn from the adult learning environment. And I think when we started this work 20 some odd years ago, we didn't know how to do that as well. But I can tell you, especially having had our advisors from across the country come in end of last year, we are committed to continuing to learn how to make that better.
Yeah, I love that, Chris. So well said. So when I think about the strengths of the TeamSTEPPS programs that I've been a part of, I think I would just start by saying my favorite part of TeamSTEPPS is it really instills the truth that we are better together. We are better together. We are safer in our care that we deliver. Our work days are better, right? We're empowered. We're watching each other's back. I know that I'm not out there alone in the fray, right? And afraid I'm going to make some kind of mistake. One of the nurses that I worked closely with through the years, she was like, if I have a really, really, really chaotic, the kind of day that, makes you just want to go find a hole and crawl in it, she says, as long as I'm doing that with a team that I trust, that I know has my back, that is offering me mutual support, and they are expecting those things from me as well, you bet. Send me those difficult days, because at the end of it, we're going to go home successful because we know that we've been better together. So one other quick thing that I would say that has been imperative for a TeamSTEPPS program is that you have a strong coaching program, that you've got targeted sustainment strategies in place that are going to take you from the place of implementation. I should rephrase that. to take you from the place of just information and move your teams into the place of transformation. And that doesn't happen in a one-time sitting in a training. You have to come back around it and back around it and back around it. You have to weave it into your culture, creating a very strong culture of sustainment. And coaching is a coaching program in place is a super critical piece of that. So those are the strengths for sure.
Thank you both. Yeah, we'll definitely, once we ask some questions from the audience, Chris, just to close the loop on your point about how we've enhanced our curriculum to really meet the needs of the workforce and the changing healthcare landscape. That's something we're going to highlight here at the end to show you specifically what we have done to transform our curriculum of the master training course. But I'm going to open it up to some questions from the audience. We've had some questions flowing in, but I'm going to kick things off with, so how can this program, how can TeamSTEPPS be used to help retain our workforce and support the sustainability of our workforce given the current climate? I know we've touched on that, but I just want to be really, targeted in that question.
Yeah, well, I can start that off. It really would be honestly, in part, telling the same story I just told 2 minutes ago, right? That idea that when we work well together as a team, we're going to hang up our spurs at the end of the day and call it good. Like we're going to be happy to be doing what we're doing. So when people are given, and just to tie in that team-based care element with TeamSTEPPS again, what the combination of those two things together, what happens then is we get to start playing in the area of our strengths. And when people play in the area of their strengths, it's the difference between a career and a calling, right? In my mind. So a career is something that I choose. A calling is something that chooses me because of the unique things about me that have caused me to go in search of that career. And so when people get to operate in their strengths, we haven't been super good at that in our healthcare models up until the last couple of years. And I think we're going to get even better at this idea of strength-based teamwork, because that's when you set people to, free to fly in the area of their strengths. And when people can fly in their strengths, that is an amazing job satisfier. That's what's going to keep them coming back, even when things are hard.
I have absolutely nothing to add. Excellent answer.
Someone else asked, so what are strategies to get buy-in or help demonstrate the need for TeamSTEPPS in the healthcare environment?
Yeah, I'll take a first crack at that, Jen, because I don't think there's one answer. Again, I reflect on sometimes folks come to us with we just had awful tragic event X happen, and it highlighted the challenges we have with team performance and communication across our teams. Can you help? And the answer is obviously we can help. Like that is the whole thrust of what we do. But that challenge highlights itself in other ways as well. And so I think if I were looking at the performance of a team and hearing about rocks and shoes that have to do with, I don't understand why X doesn't listen to me or hear me, or I can't get my priorities raised, or I'm worried we're about to go off this cliff over here and no one is listening, or we don't have a structured way to learn when things are going on. Those are all symptoms of challenging team dynamics. And are we a panacea for that? Nothing is a panacea for that. What TeamSTEPPS can offer, though, is a structured approach to moving that team-based performance forward. And so you can come at it from a lot of different ways to get buy-in. Obviously, step one is for a shared acceptance and understanding. Hey guys, we've got a challenge, and we need to work on how we improve upon that.
Yeah,
right. The person who asked it had used the word buy-in, but we like to frame it as ownership. So buy-in is something really passive, like, hey, here's my idea. I need you to do it. But really it's the ownership piece is, we're going to be doing team steps and here's why. And Rhonda, I think that's where you might go with this in your comments, um, um, but how we do it, that's up to you. You're the expert in what you do. We want this to work for you. We need your input. We need your advice on how we're going to do this. That's the key, I think. So Rhonda, any thoughts from you on how to get that own ownership or demonstrate the need for team steps?
Yeah. So I'm going to be biased here. And please understand that I've been working with healthcare teams and specifically with healthcare leaders for well over a decade. And I'm going to tell you how you're going to get the most ownership. I don't care whether you want to implement team steps across a system, an organization, or single unit. You need to get every voice at the table. You've got to hear from everyone, and no one's voice can be more important than anyone else's. So we communicate value for every voice. We empower every voice. We get the perspective of every voice, and we develop our solutions together. This is the beauty. We're going to, in a few minutes, talk to you about how our curriculum has changed and what we're trying to do in order to get the power back into the hands of the people who know what the problems are and know how to solve them. And we've got tools in our curriculum now to help you get, again, every voice at the table, finding collective solutions. Because if I have just one voice telling me this is the solution, we know it'll work for all of you. No, it might not. So bring it back, get every perspective, get all hands in.
And I think that really contributes to understanding the why behind why you're doing team steps and being able to articulate that effectively to others. So oftentimes we find out or we'll come to a course and the folks in the room don't know why they're there, So how can leadership, whether formal or informal leaders, communicate why we're doing team steps, whether it's based on clinical outcomes, whether it's based on stories so what is that why and what is it? And that we talked about that in our webinar last month, our December webinar, which for those that want to look back at that, we have that recorded up on our website.
Jen, can I make just one more comment on that? That bringing every voice to the table, it absolutely has to include leadership support. Because if the one thing that, well, there's a few things, but something I've seen that will absolutely tank a unit or an organization's implementation if they don't have full executive buy-in. That support and accountability has to come from the top. Where I've seen it fail is when in an organization, for example, is when the executive leader has allowed departments to opt out. Like, we'll hold this department to the fire, but it's okay. You don't have to really do this. That's the surest way to sink it, folks. It's got to be executive commitment saying, hey, nobody gets to opt out. It's a new day. We are moving towards change.
And with that executive commitment, I would challenge others to have those executives role model the TeamSTEPPS tools. So just as we mentioned earlier on in the webinar, TeamSTEPPS can be used by executives in their daily non-patient care setting. They can send SBAR emails. They can call for briefs, huddles, or debriefs. So it's having those leaders role model the tools and not just, be able to walk the talk there.
I worked with the CEO of the organization. Every single day he did a walkthrough on the units just to say, I see you. Thank you for what you're doing. Made a world of difference in that culture of our organization, in that, we want to come back tomorrow.
Yeah. Well, I want to thank you both for being able to answer these rapid fire questions that I threw at you. But I want to just, with the last 10 minutes, be able to really close the loop on, what we've alluded to throughout today. So now that we've discussed the importance of how an interprofessional teams can utilize TeamSTEPPS, I'd like to take, the remaining few moments to share how we at AHA Team Training have enhanced the Master Trainer course curriculum to support our interprofessional teams. And so before I do that, I think it's really important to go over the who. So we talked about this in some of the questions early on. So who is involved as master trainers and what the expectations or what their role can and would be. And so it's critical that when you're identifying who should be a master trainer, to anticipate who can fit in or fill what roles. So as a master trainer, you might have multiple roles, but at least one of the following. So you'll role model the behaviors. That's the bare minimum. You've attended the course, and so now you're going to utilize the tools in practice. And also you'll have the skills to provide that just in time or in the moment coaching to peers. So I would kind of consider that like non-negotiables. That's the baseline. But some master trainers will ultimately teach or facilitate TeamSTEPPS courses to others. Master trainers may assist in developing and overseeing the implementation plan and support or serve as a member on that change team. And in our, TeamSTEPPS world, we see the change team as that interprofessional group who oversees the implementation and sustainability of TeamSTEPPS. So how is TeamSTEPPS being utilized in our unit, department, hospital, what have you? Is it making an impact? Are all the staff members trained up on TeamSTEPPS? Do we need to do a refresher? So they're providing that oversight and helping move the needle. And so, in addition to anticipating the roles of master trainers, there are a few other considerations I want to highlight. You'll want to select both formal and informal leaders, which I think has been loud and cleared on this webinar. And so sometimes when we work with groups, they tend to want to select master trainers who just have that formal leadership position or are people leaders or managers. So you'll want to include them, but just as important are those informal leaders. So who at your organization can you think of? What people are respected by their peers and can really motivate change, even though they might not have that formal leadership position? So, next, as Chris and Rhonda mentioned, you'll want to consider having that interprofessional group. So doctors and nurses, yes, but beyond that, can you consider techs, administrators, risk managers, dentists, dietitians? And then finally, you should consider those who will serve in one or more of those master trainer roles that I just shared. So you may have a few in mind, you would, that they would feel confident in teaching and facilitating TeamSTEPPS, whereas you might have master trainers in mind that you're like, oh, there's no way they're going to be able to dedicate a lot of time, or they might not have that skill set to teach, but you'll expect them to role model the tools and coach their peers. So just considerations to have. But I'm going to hand it off to Rhonda, who's going to share the 3 areas of what we've specifically done to adapt our curriculum to support our interprofessional teams.
Yes, thanks, Jen. And I love this. I wish I had 20 minutes on each of these slides, but let me just hit the highlights. Human-centered design thinking. We are changing the way the teams work together in our master trainer courses. When we've redesigned all of day 2 to really support that interdisciplinary collaboration that we've been talking about, honestly, this whole webinar. So how are we doing that? Our goal is that teams that work together in real time get to work together in our courses. And they're going to do things like finding their organizational why, doing empathy mapping on key stakeholders, creating the beginnings of an actual game plan for their implementation. So it's this beautiful thing where they're up out of their seats, they're ideating, they're brainstorming together, they're arriving at collective solutions, all through these human-centered design canvases. It's incredibly powerful. One of the other things that we're doing in our curriculum is working really hard to make sure that, as Chris mentioned earlier, we are staying culture current with the issues that are affecting you every single day. So it's always been an issue, this issue of psychological safety. It's always been an issue in healthcare, but after the pandemic in the last few years, it is absolutely paramount. And that's because trust and empowerment are really requisite for healthy interprofessional teams. And I'm telling you, that will not happen accidentally. You have to do it on purpose. And so that psychological safety piece, we've worked that into our curriculum because you're never going to have empowered teams that trust one another enough to speak up or offer mutual support when it counts if you have not fostered psychological safety. So we work in those key components into our mutual support module, doing exercises, for example, on what are the barriers to speaking up and how do we counter those? Because at the end of the day, every team member has to believe when they step into that team, they've got to believe that it's not only safe, it's safe and expected, that they're going to take risks, that they're going to express ideas and concerns, they're going to speak up with questions, admit mistakes, all without fear of negative consequences. So super important. We try and teach that in our leadership modules too, saying, look, you got to make it your briefs, huddles, and debriefs, psychologically safe environments. That's where it starts. And that's going to level set for it happening out there when the rubber's meeting the road. Oops. Oh, there we go. One last thing. How are we doing on time? Okay. So the other thing about our curriculum, we are working really hard to support those interprofessional teams by creating a map for consistency and high reliability. So how are we doing that? So TeamSTEPPS tools that we're teaching you, and this includes the TeamSTEPPS 3.0 tools, right? Like cross monitoring and iPads. And what we're doing with those and with all the timeless tools of TeamSTEPPS is we're structuring reproducibility through some very predictable processes. So things like those briefs and those huddles and debriefs. We're decreasing the noise through shared language. We are using those tools like SBAR and CUS, right? That's going to help us focus in the moment and get us to where we need to be in that moment for safe care or effective teams. And then our curriculum is meant to drive out variation through tools that are based on best practice. TeamSTEPPS is evidence-based. It always has been. And when we get consistent about employing, again, things like standardized handover tools, closed loop communication, we're driving out the variation based on those best practices. And part of what we're doing in our curriculum as we talk about doing that with our teams and team-based care is, for example, accounting for the fact that some of our team is now virtual. So we've got to, when you come to our courses, we'll be giving you tips and tricks on how do you structure reproducibility and predictable processes through a team that may not even be geographically in the same space. We'll show you how to do it. So all of those issues that are impacting our teams in 2024, we're going to get you to high reliability with our courses.
Yeah, I'm really proud of the work we've put in to the curriculum. We've been very mindful and purposeful with the enhancements we've made and have really gathered and sought a lot of input from our advisors from across the country. And so, yeah, sorry, Rhonda, I stole your thunder.
I see we're at the top of the hour. Yeah. People can read those. Do you want to move on?
Yeah, let's get to the announcements. But first and foremost, I want to thank both Rhonda and Chris for being here today, for having a really wonderful discussion. And again, if you liked what you heard here, come visit us in Chicago in June. It will be hopefully lovely weather. And you could attend a TeamSTEPPS Master Training course. But just a few housekeeping items to close us out for today. Please complete the evaluation that will appear in your browser once the webinar ends. We really value your feedback. And another reminder with the continuing education credit, we've included the phone number that you can text the code KEBTAY to. This webinar is being recorded, So, and will be available on our website in the next day or two. So you can always revisit this or share with your team members. But really, we want to thank you for your time and attention today. And if you need anything, you can always email us at that teamtraining@aha.org email. So with that, I'll close us out by saying thank you once again, Rhonda and Chris, and I hope everyone has a great rest of your day.
Take care, everyone. Thanks for joining.